Hello, everyone. Welcome to the Worker, Employer, and Provider Perspectives on Creating Effective Work, Return to Work Strategies, Learning from Current Research webinar. This webinar is part of our Return to Work, Stay at Work series. We're very glad to have you here with us today. My name is Tanya Hyde, and I'll be moderating the webinar today. I'm the project manager with the Canadian Institute for the Relief of Pain and Disability. And this webinar is made possible through the support of the Community Grants Program through the BC Government, as well as through donations and memberships. As I mentioned, my name is Tanya, and I'll be moderating this session and handling the Q&As today. And our speaker today is Mary Sturgiakida. She's an assistant professor in the Department of Occupational Science and Occupational Therapy at University of Toronto, and also an adjunct scientist in the Institute of Work and Health. Dr. Kida's program of research focuses on work reintegration across rehabilitation populations, including traumatic brain injury, electrical injuries, cancer, and burns, and she aims to bridge health and employment contexts to develop strategies which enhance clinical practice, workplace supports, and improve return to work outcomes. Thank you very much for being here, Mary. I will hand it over to you.
Okay, thank you. Well, thank you for the introductions, Tanya, and thank you for inviting me to do this presentation. It's actually a great pleasure to be here and to be given the opportunity to really share with all of you some of my most recent learnings from some of the current research that I'm involved in. So I entitled the presentation Worker, Employer, and Provider Perspectives because what I was really hoping to be able to do today is to really try to demonstrate the importance of return to work teams and thinking about the different players in that return to work process, being able to work collaboratively, and also I wanted to be able to show you how, from my perspective, by researching these various perspectives, what I think is important from the perspective of being able to get a more fulsome understanding of how we support individuals to successfully return to work. The way I intend to try to do the presentation today is to actually provide you with two examples of studies I have led most recently. Very kind of briefly as an overview, my research goals, as Tanya had indicated, were really to try to bring together stakeholders to identify strategies and develop tools that will facilitate work reintegration, enhance inclusion across rehabilitation populations. So what I'm really interested in being able to kind of understand is, to some extent, across these populations, what are some of the strategies that are beneficial, and what are some of the challenges that we may be still experiencing. And for me, the whole idea of enhancing work reintegration, I see as something that happens along a continuum that starts with the time when people may be off at work, proceeds into the kind of the process of returning back to work, and also becomes important from the perspective of what strategies people need or the assistance they need to stay at work. And when I started some of my studies, my graduate studies, and in my initial research, I focused mostly on developing guidelines, and this was mostly to assist clinicians in being able to assist individuals in determining their work readiness and making that transition back to work. And most recently, my interest and my research focus has tended to be more around kind of what happens more specifically at the workplace and how we can assist individuals once they're back to work and to more particularly stay at work. And I've been examining issues around workplace supports and accommodations across a variety of populations, looking at issues of stigma and discrimination, and most recently also examining issues around workplace health and safety, more specifically for men in high-risk types of occupations. And so what I would like to actually do today is focus more specifically on the idea of workplace supports and the idea of workplace accommodations and what we've learned about workplace accommodations. And the question that's on this particular slide is, why focus on workplace accommodations? And I think for me, there's three particular reasons I'm interested in workplace accommodations. First, we do know from workplace supports from both research and clinical perspectives are essential to successful return to work, particularly in more complex kinds kinds of situations where people have multiple physical, cognitive, and psychosocial issues that they're dealing with. Second, we don't really have a good understanding of what happens in the process of actually implementing accommodations. So while we know they're important, we don't really know what processes we need to put into place to ensure they're effectively implemented. And thirdly, while many people are often familiar with physical accommodations and understand the need for us to accommodate individuals with physical disabilities, developing accommodations for persons with cognitive and psychosocial disabilities, I find has been a particular challenge for a number of individuals, and that's also a particular interest of mine. So before I actually start and share some of the information or some of the data from our research, I just wanted to, and Tanya is going to help us with this, and we can take up some of the answers at the end of the presentation, but just to help us get into the mode of thinking about accommodations, I have a little bit of a true and false set of questions. And so I'm going to read each of those questions, and I'm going to ask you all to register your responses as either true or false in relationship to workplace accommodations. So the first statement said employers are only required to provide accommodations for workers who are injured on the job. True or false?
And the result is about 11% said it's true and 89% said false. And this is out of, there's about 80 people online right now.
Okay. Okay, and I think in most cases, employers are required to provide accommodations for individuals who are injured at work, but also for individuals who might not have actually been injured at work, but might experience a disability. So question number 2, or statement number 2, a worker must disclose an injury, illness, or disability to an employer to be provided with a workplace accommodation.
And our results were 65% said true and 35% said false.
Excellent. So this is an interesting question because I think the statement, workers do need to disclose a need for an accommodation in terms of requesting an accommodation, but it can be tricky in some cases, and we'll see a little bit with some of the cancer data where how they disclose may become something for consideration. And third statement, workplace accommodations must not put another employee at risk or contravene the requirements of occupational health and safety legislation.
100% said true.
Yes, and I think that is true. There are regulations with regards to that, and I brought this up just in terms of us always being aware of the occupational health and safety pieces. Workplace accommodation should not include supports that an individual requires outside of the workplace, for example, transportation to and from work.
And looks like we have about 43% say true and 57% say false.
Okay, so that's actually interesting. And I don't know if there's an actual right answer to this. I don't think there's specifics around accommodation legislation that define what accommodations can and cannot be. But it does bring up the question about reasonable accommodations and how we perceive what's reasonable and what's not, and that's something I will show you in some of the data as well. That's kind of interesting. And the last question, as a service provider, I must be objective and not recommend a modification that an insurer would not agree with.
And the results are 24% said true and 76% said false.
Okay, and I'm actually going to leave that one because it might be something we might want to discuss at the end in terms of people's perspectives or perceptions with regards to that. So thank you for participating. It feels a little bit odd not to be able to get that kind of response, but if there's any questions, we can discuss some of those elements at the end. I just wanted people to get their heads into thinking about the accommodations piece. Okay, so when we look at workplace accommodations, I will use two specific case studies of two separate studies. The first was where we looked at workplace accommodations following electrical injuries, and the second case study is a more recent study I've led where we've looked at workplace accommodations following cancer. So to start off, I just have a general definition of workplace accommodation, so we're starting in the same space, and I like this definition for a number of different reasons. First of all, I like it because it talks about workplace accommodations from the perspectives of modifying jobs as well as workplace environments. It recognizes that workplace accommodations work under the premise that we're looking at qualified job applicants and they can do the job, and it also highlights the importance of thinking about workplace accommodations along the return to work and work career trajectory. So looking at the accommodations from the perspective of from the job application process to actually returning to work through performing elements of the job. So the first study that I'm going to share some findings from was called Promoting Employment Success Through Workplace Accommodations Following Traumatic Brain Injury and Electrical Injury. And what I'm going to be presenting to you today is some of the data more specific to electrical injury. And in this particular case, we combine those two populations because we were interested in understanding some more of the psychosocial and cognitive elements of the accommodation process. I'm going to start with just a quick slide just for individuals who might not be familiar with working with individuals who have had electrical injuries. Just to give you some background information, electrical injuries can account for up to 4% of all fatalities. Occupational groups that are most likely to suffer an electrical injury include those who work directly with electricity. So this includes electricians, apprentices, linespersons, or individuals who work with electrical equipment, and this is where it could be quite broad, but most often it includes individuals who work in construction, installation, maintenance, repair, and transportation and agriculture. And one of the biggest issues with a lot of the electrical injuries is that they can result in a number of different types of impairments, many of which most people aren't aware of. So it can include burns, musculoskeletal injury, neuromuscular types of conditions in terms of motor neuron disease, cognitive challenges in the areas of attention, memory, processing, speed, and new learning, and a lot of challenges from a psychological perspective. So for a lot of individuals who have experienced an electrical injury, anxiety and depression can be an issue, and for individuals who have experienced an electrical injury specifically in relationship to their work can often experience post-traumatic stress disorder types of symptoms, especially when they're returning back to work and fears around returning to work. So just to give you a little bit of background information on how we did the study, essentially we interviewed 13 workers who had experienced workplace electrical injuries and 12 employee representatives. So our workers included 20 males and 1 female, and this gender distribution or gender differences is quite common within the electrical field. The workers included workers who had worked as journeymen, as electricians, engineer, millwrights, electrical technicians, laborers, and 1 service worker. Our employer representative actually we interviewed individuals who actually worked directly in the workplace and targeted individuals in different workplaces that were specifically responsible as within their job description to assist individuals to return to work. And rehabilitation personnel, and most an acute care setting as well as a rehabilitation setting that has specialized services for individuals who have had burns and electrical injuries, and used in terms of analyzing our data, we use something called thematic analysis. So what I wanted to share with you now is 3 themes that I think that actually related more specifically to the accommodation questions we wanted to learn about, and what we learned in terms of how electrical workers themselves thought about or understood or conceptualized accommodations, what we learned about the types of accommodations that were most frequently requested and provided following an electrical injury, and some of the challenges that workers described in relationship to requesting and receiving or through the provision of accommodations. And some of the key kind of elements that we found most interesting really revolved around workers' own perceptions of workplace accommodation. So while we went in thinking before the study that workers would all be wanting to advocate for accommodations, what we learned was a lot more kind of interesting and nuanced. So we found that while many workers discussed the need for support at the workplace when they return to work, many were concerned that in practice this may leave them in a particular position where they might have to actually accept what they considered a make-work job. And second, evident consistently across our interviews were perceptions that it was meaning the worker's own responsibility to establish accommodations for themselves rather than the workplace's responsibility to provide accommodations, despite what we know about supporting legislations that are out there, and the fact that they do in fact have a right to request an accommodation. So just to give you a little bit of a sense of the idea, what they meant by make work jobs. So what we heard a lot of electrical workers saying is, I don't want to make work job accommodation, I want to return to my pre-injury job. So as one of the workers, one of the electrical workers said, I made it a point, speaking to the return to work coordinator in rehab, I didn't want to go back to work to any light duty stuff, you know, modified. There's no point in me going back to doing something that's not my job. If I can't do my job, then I'm going to have to do something else. I kind of stressed before I started the whole back to work process that I didn't want to do that kind of stuff, like a long-term light duty kind of thing. And from the personal kind of responsibility perspective, a sense that in reality, for some individuals, accommodations may not necessarily really exist. And so as one of the electrical workers says, you don't really have accommodations. If you're given a job, it's like people, I don't think anybody really cares how it gets done. It's just, it gets done, right? There's no point in whining about it and crying about it. You just got to do it, right? If I can't do my job, then I have to do something else. So a very, very kind of strong sense that the provision of workplace accommodations was a personal responsibility versus a right, despite, as I had mentioned before, the number of legislations, both federal and provincial, that we have, and I've listed a few of them, that support the provision of workplace accommodations in Canada, and in this case, Ontario, where we did this particular study. And in a relationship, when we looked at the types of accommodations offered, what we saw was that while some accommodations were offered, we did find that there tended to be a very limited scope. So there was the most common accommodations that were most frequently offered included some description of restrictions and limitations as well as modified hours. This was followed by the provision of adaptive equipment, and less frequently actual discussions around accommodations from the perspective of modifying job tasks and duties, and lastly, very, very little kind of discussion around, a little bit of discussion, but not a great deal of discussion around providing personal assistance within the context of the workplace. And for individuals who had experienced troubles receiving accommodations, they felt that there were likely two explanations or two groupings of explanations provided for these particular challenges. The first were challenges related to the visibility of their particular disability and the subsequent issues of legitimacy that engendered. And this could include a poor understanding for some people of the severity of their electrical injury, a poor understanding of how long the sequelae may last, and subsequent concerns about the legitimacy of their time off from work and legitimacy from a WSIB claim perspective. So as one participant, one electrical worker said, I don't think my employer realized how severe the injury was, so I think he was trying to push me into being able to do my job without complaining. Just forget about it and go on with working. And the second big kind of challenge to the accommodation process from workers' perspective was that in many cases they felt that lip service was paid to the idea of providing accommodations, and individuals initially, and employers may have initially identified that they would be willing to provide accommodations, but that there was often not necessarily follow through with that. So for this particular client, he said, for this particular participant, he said, no repetitive work, no climbing ladders, no heavy lifting were recommended. So those were the recommended accommodation. But they, the employer, didn't do nothing. The employer said he would, but he didn't. And to show you then a little bit about how employers view the accommodation process and their responsibilities regarding the accommodation process, there are three key themes that were quite interesting within those employer interviews. The first revolved around strong beliefs that almost all employers expressed around related to early and safe return to work. The second was in relationship to how employers understood the process of workplace accommodations and their responsibility or their role within the process. And the third were interestingly enough, were some of the challenges from their perspective that they described in the accommodation process. So when we took a look at some of employers' beliefs, that there was There was a strong belief about the importance of early and safe return to work that really very much matched the WSIB's early and safe return to work policies. So early return to work was seen as beneficial for employers, workers, and insurers as a way of containing costs, enhancing worker recovery, and preventing secondary disability. So as one employer said, if a worker's off for 4 to 6 weeks, then there's a 95% chance that he will come back, a perfectly functioning worker. If you let it go for 3 months and it drops down to 80%, if it goes beyond a year, then you'll probably never get that worker back to work. It's not so much based on the severity of the injury, getting the worker to feel good about themselves, getting them to be productive. If you're usually feeling good about yourself, right? So it just goes hand in hand. So the sense of the importance and the belief that individuals needed to come back to work was very strong. And when we looked at employers' kind of understanding of return to work, what we found was, to a large extent, most employers had a very, very good understanding about the importance of modified work and graduated return to work schedules. But some confusion about whether the offer of accommodations needed to extend to other ill or disabled employees within their particular work context. And I think this is probably also because of the fact that, to a large extent, they were thinking about it from a WSIB context. So there was lots of descriptions about processes that were put in place to gradually integrate people within the context of the work, as this quote actually illustrates. But there were also a number of challenges that employers described in the accommodation process. So some of the challenges actually related to understanding electrical work and the uniqueness of electrical injuries and electrical work. Some of it actually also dealt with and was similar to some of the actual worker concerns around legitimacy of electrical injuries and accommodations. But the one interesting piece from the employer perspective that was a little different was their concerns around the information that they were receiving and the adequacy of the information the health information to be able to make strong accommodations. So when we looked at inadequate information, often employers said that they were often provided with inadequate information to determine best accommodations. And this could result from delays in diagnosis, inadequate information from WSIB, or inadequate information from health providers. So as one employer stated, it's pretty tough. We have limited medical information to go on. Even if the functional abilities form tells me that some doctor has said, yes, this worker is allowed to lift so many kilos over their head or stand so long or walk so long, it really doesn't give me a great picture as to what they're capable of. So often this kind of disconnect between identification of limitations but not necessarily linking that to what the individual is able to do in relationship to that individual's job. And secondly, some of the discussion around information also from an employer's perspective, or some of the challenges from an employer's perspective, also revolved around the issue of privacy and disclosure and how to manage that information within a workplace context. And as one employer said, I get the privacy perspective as far as the information, but there's so much that employers don't know. There's poor communication. You have inexperienced adjudicators. The board calls me and says, we're processing lost time benefits. I'm going, why? Well, he's had an injury. He never told us. It doesn't matter. What's wrong with him? I can't tell you. What are his restrictions? We don't know yet. That drives me around the bend. So this kind of idea of adequacy of information sharing was a big concern for many employers. From a uniqueness of electrical injury and electrical work perspective, employers describe challenges in being able to accommodate the confluence of physical, cognitive, and psychosocial challenges in combination with some of the unique hazards for electrical work and the subsequent challenges in being able to find meaningful alternate work for some of the electrical workers. So as one employer said, someone who's even been on the periphery of the actual accident, where maybe there was a large flash, these are the large flash injuries that occur, flashes that occur in electrical injuries. They've seen a partner on their crew badly burned. Just the trauma of that experiences, can prevent them from coming back to the trade successfully. It's a trade where electricity is an extremely tricky hazard. They really have to keep their heads together. They've got other people that are depending on them to ensure that what they're doing is correct. In skills trade, if you can't do that particular trade anymore, you're kind of limited. So they talked about some of the specific challenges they had in relationship to the actual job, and I think in this particular case in relationship to concerns they might have had for not only the returning workers' safety, but for co-workers' safety as well. And lastly, and very similarly, or related to some of the worker concerns, was the issues around perceived legitimacy of electrical injuries and accommodation. So this sometimes stemmed from poor knowledge about the severity of electrical injury, and sometimes it stemmed from concerns around legitimacy and how legitimately injured people might be, and how legitimate their request of accommodation might be. And as one employer said, there's an old joke out there that, oh, you got a Dr. Winter helping you out, saying that you need modified work for the entire winter, right? Or Dr. Summeroff. There's a lot of guys, co-workers out there who figure that an injured worker sometimes isn't injured as bad as they're making out they are. So there are some hard feelings, and there's sometimes co-workers asking, how come this guy gets to sit back and do all the easy stuff on the project? So lots of kind of concerns from employers' perspective of how to manage those legitimacy issues and how to manage communication within the context of the workplace. So when we examine a little bit closer some of the convergence and the divergence of those particular perspectives, what I find kind of interesting is where, you know, this kind of whole idea of narrow understanding of workplace accommodation rights from the worker's perspective seem to also kind of converge to some extent with a narrow scope of accommodations that employers regularly provided. So while I mentioned that gradual return to works are frequently kind of implemented regularly, that often the larger kind of scope of what might be possible was not necessarily considered. The contested legitimacy, as I had illustrated, where it was an issue that was brought up between both groups. The desire for meaningful work and not having make-work jobs was a concern for workers, as it was a concern or a challenge expressed by employers in terms of being able to provide alternate meaningful work. And for workers, follow-through seemed to be of greatest concern, whereas for employers, being able to get really good information from which they could develop really effective accommodation seemed to be one of their biggest types of concerns. So. And then we also, in that particular study, took a look at being able to identify processes that both of those particular groups may have discussed in terms of that were necessary in making effective accommodation recommendations. And what they identified is the importance of identifying just right tasks and duties, the importance of ensuring effective communication and a response to the needs when they were identified, and the importance of ongoing education, advocacy from that legitimacy perspective, and monitoring to ensure effective implementation. And just a few examples of some supporting quotes about in situations where they felt accommodation processes went well. As one individual said, one thing they offered me, so this was a worker, was that they needed guys to go out and just look at job sites. That seemed to fit the bill, right? Because they didn't have to work physically, just go look at things. I know what I'm looking for at the job site, so it was a good fit for me. And another worker said, my employer was very cognizant that they had all the reports because this was a work-related injury. Workman's compensation was involved. They're feeding reports back to employer that are coming from the rehab hospital and everything else. And everyone was very aware of my situation and what my limitations were. And as one employer stated, we actually have a log for workers who are being accommodated, and the expectation is that the immediate supervisor will meet the affected worker. It's just a very short conversation, a 2-minute conversation, and asking, how are you doing? How are you feeling? Are there any issues? What about the modified work? Are you getting enough of it, or is it too much? And then that is recorded in a log that's kept for the corporation's use to make sure that we're staying in touch with the employee, to make sure that we're not hindering his recovery in any way, and to make sure, quite frankly, that the modified work being offered is still meaningful and still appropriate. So that just gives you a sense of what we found with the electrical injury piece. I'm going to continue and show you a little bit of the data from the cancer piece more specifically. So this study was entitled Cancer Survivorship and Successful Return to Work, and we specifically focused the study on the whole area of workplace accommodations. And for this particular study, we actually extended our perspective to one additional stakeholder group. So we looked at cancer survivors, so the workers themselves, employer representatives, but also interviewed service providers in this particular study as well. And so we had three primary questions in relationship to the accommodations piece. The first was what types of workplace accommodations are most frequently recommended for and provided to cancer survivors. What processes do survivors, service providers, and employers identify as relevant to ensuring successful identification and implementation of workplace accommodations? And what challenges are reported experience when they're providing or receiving workplace accommodations following cancer? We used semi-structured in-depth interviews again, and in this particular case we actually interviewed 40 participants. The interviews lasted anywhere between 1 to 2.5 hours. This included 16 survivors, 16 service providers, and 8 employer representatives. And once again, we digitally recorded and transcribed the interviews and used the inductive thematic analysis approach for the actual analysis. And just to give you in the next slide a sense of who the participants were. So our survivors included 12 females and 4 males. They encompassed individuals with a variety of different types of cancer diagnosis, so quite a broad range, and individuals who worked in a variety of different types of occupations. Our service providers included 15 females and 1 male, and we included healthcare providers, vocational service providers, individuals in the community who were providing rehabilitation services, and we actually had 1 lawyer because we wanted that advocate kind of perspective as well. And from an employer representative perspective, we had 6 females and 2 males, and this included a variety of individuals from a human resources perspective, occupational health and safety perspective, consultants, disability management kinds of consultants, and rehabilitation team leaders. So, and for our employer representatives, this was actually people who were providing the support within the workplace. So what I'm going to do is share with you similar types of findings from this particular study as the electrical study, so we could do a little bit of a comparison. So I'll talk a little bit about the types of workplace accommodations, the processes and strategies felt to be relevant to ensuring effective workplace accommodations, and some of the workplace accommodation challenges that the 3 groups described. So from a type of workplace accommodation perspective, once again we found that the graduated return to work plans or the graduated return to work process was something that almost everybody was familiar with and was fairly consistently kind of applied. We did find, which was kind of interesting within this particular study, and it may have been the people that we had interviewed and their expertise, but there did seem to be further discussion around modification of work duties and performance expectations. A little bit of further kind of understanding about the potential that retraining and supports that the workplace could have in terms of facilitating successful return to work, and some discussions around modifications to the workplace environment and adaptive aids. So there tended to be a little bit of a broader scope of the types of workplace accommodations individuals were actually discussing. So to give you a sense of some quotes just in terms of some of the findings. So for anything that says E is an employer representative, anything that says P is a provider, and the S's are survivors. So as one of the employer representatives said, we tend to look at modifications of their hours with corresponding reduction in duties that they might be responsible for, so that they're not trying to do 8 hours worth of work in 4 hours. And I thought this was kind of interesting. So it's not just the number of hours, but thinking about the duties in relationship to those hours. And as one of our providers said, it was important for her employer to understand that when she, the survivor, came back to work, it would take her time to gradually build up her time at work and her speed. Because of the residual neuropathy in her fingers, so speaking specifically to the cancer-related impairment, initially it would take her longer to type a document. What previously would have taken her 5 minutes might now take her 8 minutes. So really being able to identify how those impairments relate to actual work performance and what would need to be accommodated. And as one survivor said in describing the importance of having some gradual time to reacclimatize and to reorient herself, she said, it was a weird feeling being back at work. Obviously familiar because I had been there before, but it had been such a long time. I did feel very much like I was starting a new job again, and I was feeling anxious. Having that retraining period did help because I wasn't just thrown back into my job on my own. So in terms of some of the processes and strategies relevant to ensuring effective workplace accommodations, I think in this particular case, we were able to identify some more nuanced processes within that workplace accommodation process that I think is also helpful to know about. So in this particular case, we've illustrated as 5 different steps, with the first step being the importance of all the different parties being knowledgeable about workplace accommodations, and then moving into being able to initially establish an employer's ability to provide accommodations, and then the ability of the individual as well as the employer to negotiate or come to some determination of what might be reasonable accommodations, being able to develop and customize those accommodations more specifically to the individual and the job needs, and then having some process in place to ensure the implementation of the accommodations, and monitoring those accommodations to, 1, make sure they were put into place, and 2, to make sure they were modified as they were needed. So just a couple of supporting quotes. And this particular survivor talked about the importance of being able to clearly identify make a case for the reasonableness of the accommodations that he was requesting. So he said, I had taken this workshop and had learned how some requests for accommodations are rejected for some people. So what I have said to myself is what I need to do is to make a case for my accommodations, make sure it's not too way out there, that it's not unreasonable. One accommodation I asked for was a smartphone because a lot of my work requires me to monitor social media channels and our website on a regular basis, and I didn't want to be tethered to a computer all the time to carry it around. And I explained to my employer, do you mind paying for an iPhone so I don't have to carry a big laptop around on weekends? It makes me more agile in my job, and they accommodated it. So I instilled the fact that I wanted to work for them and that I'm a good value as an employee. I wasn't asking for pie in the sky, unreasonable accommodations that would make it difficult for them to provide to me. And as provider number 13 said, the people for whom accommodations seem to really work for are those who have thought about it in terms of task specificity. In addition to recommending a gradual return to work plan, identify what do they have to do during that graduated period. And as one of the providers indicated, I recommend ongoing weekly predetermined check-in. So this was in relationship to ensuring things were put into place and were monitored properly. So that this isn't relying on the survivor employer alone. And I say, I want to meet with you, and actually it's scheduled beforehand. So they don't need to make an effort to make a phone call. I call and ask, how are things this week? So making sure those things are scheduled on a regular basis. And lastly, with regards to some of the cancer and accommodation pieces, I wanted to share with you some of the categories of challenges that were described across the 40 interviews. So from survivors' perspective, it was interesting. Lots of survivors talked about their fear in requesting accommodation. And these fears stemming from a fear of appearing different, fears in relationship to perceptions of their work abilities and job loss or potential, and fears with regards to disclosure and protecting their privacy. The second big category of accommodations really related to challenges in developing clear and specific accommodations. So a lot of both providers and employers discussed concerns about vague accommodation recommendations or accommodation recommendations that were not adequately supported by medical documentation. From a job-specific perspective, some challenges were also expressed in relationship to the challenges in actually accommodating more physically demanding jobs that were perceived to be of high risk, and high risk was defined as in relationship to either consequences of errors kind of occurred, and high performance from the perspective of jobs that had high performance demands or high responsibilities. And from the perspective of what we kind of categorize as workplace challenges, there were issues in the accommodation process when there was perhaps strained pre-cancer relationships, when there was insufficient or inflexible return to work policies and practices, so there was nothing that they could work with in that employment situation, when employers had concerns with regards to productivity and setting a precedent if they offered one particular employee an accommodation, and what that would mean in terms of other employees wanting accommodations, and in some cases this perception that there might be limited opportunities for modified duties within the context of that particular workplace. And as one survivor, and the first survivor explains the kind of fears around requesting accommodation. The very idea of asking for an accommodation, if you were to say that there could be an issue of you doing the job, the employer would say, okay, we're going to ask you to step back from this temporary position right now and have someone else do it. And as one employer described some of the challenges around vague recommendations and how that impacted their ability to develop effective accommodations. So employer 2 said, generally the restrictions come from the clinician, from the physician. Physicians, I know, sometimes they're giving their best guess, but I have also seen physicians write restrictions that make absolutely zero sense. I had one yesterday which management was quite alarmed about because it would impact how they assigned work. It indicated the survivor could not wear street clothes but must wear coveralls supplied by the employer. And I'm like, well, they have to wear street clothes to get to work, to wear the coveralls, so it's not making a lot of sense. So challenges when those restrictions or limitations don't make sense. And this is actually kind of interesting because this was a couple of different quotes from two different individuals. So one was a provider and one was an employer, and they were talking about the types of jobs that might be too difficult to accommodate, and they're actually both talking about a nursing job in this particular case, but have very different perspectives. So the provider says there are some jobs, like say you work in a pizza store and you can't flip a pizza. What are you going to do? It's not like a nursing job where there's this perfect role for you as a nursing resource person where you can do blood work or give out information. That's like an easy thing that you can do. There are not always substitute jobs for every position. And as one of the employer representatives says, those nurses that present with some cognitive limitations, sometimes we are unsuccessful in being able to accommodate them. Healthcare is a risk-sensitive or safety-sensitive job, so if they present with significant cognitive issues related to judgment or attention and concentration, it poses some difficulty in being able to place people safely. In terms of cognitive limitations, I would say that we have not been successful in placing someone who has a professional background, so nurse or an executive member if they have these kinds of limitations. So that was just quite interesting there. And so just in terms of kind of wrapping up and some kind of discussion points, what I think is kind of interesting, or what I found interesting in thinking about some of the findings across our different studies, is that there seems to be some real positives. So there seems to be some general awareness of the need and potential benefits of workplace accommodations. And many workplace accommodations are actually being recommended and implemented. And as we see, the whole idea of graduated return to work plans are fairly standard practice. But I also still see a number of kind of key gaps that I think we need to be thinking about from a both clinical perspective and a research perspective, is the challenges from the perspective of poor clarity and medical restrictions and the specificity of accommodations that makes it very difficult, particularly for employers, to implement things in practice. The second big kind of issue I see relates to really stigma and requests for accommodation, and I think the legitimacy discussions within the electrical injury piece also speak to some of these kinds of concerns. And I think from the cancer perspective also a recognition, and also from the electrical injury perspective, that a recognition that individuals who are injured may require supports on an ongoing basis, and may not necessarily be a one-time type of accommodation process. So ongoing challenges and some potential kind of recommendation. I still think there's a little bit of a limited scope of how accommodations are conceptualized, so I think room there from an education and research perspective to be able to document and be able to test out best accommodation practices. Inadequate specificity of accommodations, I think, speaks to the importance of really the team being involved together and using the different expertise of the team to be able to develop specific accommodation recommendations. And last but not least is legitimacy, stigma, and discrimination. And I think the whole piece to that, and I think this is actually a huge piece, is a need to really examine legislation and attitudinal barriers that exist with regards to the request and provision of workplace accommodations. Because I think for a lot of people, they would describe this process of being so afraid to ask for accommodations, but without asking for accommodation, they couldn't receive them, so they often find themselves, I think, between a rock and a hard place within that particular process. So I am open for questions, and the last slide is just an acknowledgement of the funding, but I'll leave it up to people to ask any questions that they might have.
All right, at this point, we don't have any, but I will just give it a minute for people to write down and type in whatever questions they might have. Now, just out of curiosity, are you guys looking at doing any further research in the same way but with other health conditions?
Yeah, I mean, I think the accommodations piece is something that we are quite interested in. I think in looking at it from the perspective of looking at it from individuals who have mental health types of issues. We're also interested in looking at kind of larger issues of kind of supported employment and what it means to actually support individuals within the context of the workplace itself. So we've looked at electrical injuries, we've looked at traumatic brain injury, I've looked at cancer survivorship. I think it would be interesting to look a little bit further at individuals who have mental health types of issues. And also, I think the legitimacy piece, we're wanting to look at a little bit more from the perspective of individuals who perhaps have invisible disabilities and what that might mean, and whether that makes it easier or more difficult for individuals to manage the workplace accommodation process.
Interesting. All right. And then there's one person wondering if you could talk a little bit about the last true or false question, which was the as a service provider, I must be objective and not recommend a modification that an insurer would not agree with.
Yeah, I put that in there because I think for I think that that particular question probably speaks to a little bit of kind of a judgment call piece to it. I don't think there is anything limiting anybody from making a recommendation that somebody actually needs. I think, though, one of the challenges sometimes when you're working in a disability management type of context is being able to provide enough of a rationale for that particular accommodation. So I think that is, I put it in there because I think it's an area that lots of people kind of struggle with when they are working in those disability management contexts. So I personally would never not make a recommendation because I thought an insurer would disagree with that particular recommendation, but I would be clear in being able to kind of support that request for an accommodation and to make it clear how that accommodation will actually facilitate that individual's ability to do their job and to do their job well. So I think I put it in there not because that there's necessarily a true or a false or a yes or a no kind of response, but I often find that it can be difficult, especially when you're working in that particular context, to often be able to be cognizant of some of the pressures that kind of exist within that context. And the challenge, I mean, with the workplace accommodation piece is the way the legislation is set up. You know, we need strong advocates to advocate for those accommodation requests, but what we find in reality, it can be very challenging in those employment contexts in terms of how comfortable and how fearful injured workers are in requesting those accommodations, and part of it is also how it's going to be perceived by their employer, their co-workers, and so on and so forth. So I think those are some of the challenges there. People can't speak, can they? Like,
no. People are typing in their questions, so.
Okay, because because it would be I would be really interested in finding out, because that would be an interesting kind of discussion question, why people would answer that one way or the other in terms of kind of their rationale for that. But maybe that could be something, if people have questions, they can email or we can have a discussion offline.
Okay. We did have someone who had a question around what success have other therapists had in approaching employers regarding the stigma you discussed, whether that's for pain or mental health, or specifically you had the stigma around the electrical injuries.
So say again, so what success have therapists had?
Yeah, like strategies for approaching employers around the stigma. Maybe particularly within the studies you did.
I think, well, it's kind of interesting because so really from the therapist perspective or the provider's perspective, we all can't really speak to it from the electrical injury piece because in that case we just had the workers and the employers. But what was interesting, what was most fascinating from the stigma perspective, we didn't actually ask direct questions about stigma because you often have to ask indirect questions to get a sense of to what extent people feel stigmatized or have a sense that they're being stigmatized. What we found in the cancer study, because stigma has been identified as a huge issue within the cancer community itself, specifically from survivors' perspectives. And when we started those interviews, we started by interviewing providers because they were actually the easiest people for us to get in terms of the connections we had in the community. And we asked them to talk about to what extent they thought cancer survivors would be able to return to work and to what extent they were accepted easily back within the workplace to get a sense of some of those beliefs and attitudes towards cancer survivors. And when we interviewed the providers and the employers, almost all providers and employers said cancer isn't a highly stigmatized type of disability. Mostly for a couple of reasons. One, to a large extent, it's a physical thing, and to a large extent, most of the cancer survivors would have had adequate medical documentation to support their time at work. So the legitimacy of the initial kind of diagnosis and the legitimacy for the legitimacy around kind of being off work wasn't necessarily an issue. So for a lot of the providers said they didn't think cancer survivors were necessarily stigmatized, that in comparison to other groups, employers were more likely to have them back. They were not likely to be questioned in terms of their motivation to work as opposed to somebody who had chronic pain, for example, or some other kind of low back pain, for example, where the legitimacy might be more of a question. So, and while we were doing those initial interviews, we're like, maybe we're missing something, or maybe this isn't it's not really stigmatized. Then when we interviewed the survivors, the stigma pieces that they discussed were extensive. And from their perspective, it wasn't necessarily the legitimacy that was the issue, but concerns about how they would be perceived, fears in relationship to cancer, concerns about whether they would get cancer again and what that meant in terms of costs to the employer, concerns about whether they would be able to actually adequately perform their job. So their concerns really were around not disclosing in many cases or being able to kind of protect their privacy so that their actual ability to do their work did not come into question. So I think, I think for when we've interviewed, we have actually interviewed. This is a whole other study. Interviewed service providers who have worked with individuals who had traumatic brain injuries and looked at kind of issues of stigma. And in that particular case, in most cases, I think what service providers have done is to try to provide their clients with information to make an informed decision about whether they should disclose or not, and that can often be quite a complicated type of decision because it has to do with how comfortable that individual feels sharing certain things within the context of the workplace. It has a lot to do with to what extent they think their environment is going to be supportive of them in that particular situation, and to a large extent, in some cases with the cancer survivors, sometimes survivors identify that they did choose to disclose, expecting that things would work out well, and were totally blindsided in terms of the reactions that they actually kind of received. So the stigma piece, I think, is really quite challenging, and it depends on probably really understanding that individual, understanding that job, understanding that workplace, and often really understanding that workplace culture, I think, in terms of helping individuals identify what they were going to need in that workplace. And I think the other big challenge for lots of healthcare providers in some particular situations is that they may, people may choose not to necessarily disclose a particular condition, or how they disclose that in terms of identifying what their needs might be without providing the diagnosis is another strategy that individuals will often use. But for a lot of providers the challenge where if somebody chose not to disclose, but they needed actually that kind of support, without some form of disclosure, they couldn't get the support, and then there was lots of concerns about whether they would be able to manage well, what it would mean in terms of how much they might suffer from kind of an ongoing kind of health perspective. So challenging. So I don't necessarily have one answer, but those were some of the things that did come out, and I think something that warrants much more kind of discussion in terms of how we deal with that. And the way that the accommodation legislations are set out, you know, if you don't disclose something, it's very difficult to request accommodation, but once you disclose, you actually, in some cases, make yourself quite vulnerable. Yeah.
Would you happen to have, and you don't have to, it might be something you could maybe send me later and I could provide for attendees, but would you have further researches? Because we've gotten a lot of, most of the questions are around stigma and disclosure and fear. And would you have further research resources that we would be able to provide to the attendees? Because a lot of the questions seem to be around that particular combination.
We are actually just in the process, we've actually extracted the data, but we're just in the process of trying to synthesize that piece and write the paper on the stigma and discrimination piece for the cancer piece. So I don't have it yet. We've almost, like we've got the accommodations piece, because we just have a few modifications to make that to that paper, so that should be out fairly soon. But the actual stigma and discrimination, more specifically in relationship to our research, I haven't published that yet.
Okay.
Either in the TBI piece or in the, but I'd be like happy to share anything or pass that on when we know that that's been published.
Okay, that would be wonderful.
Yeah.
That would be wonderful. And let me see if there's anything else around. Oh, someone asking.
If I knew that, that's what I would have talked about.
Well, maybe
next time.
Maybe we'll have you on for another one with that particular topic in mind. I hadn't realized that was going to be a main focus either.
That's cool, though.
Yeah. There was another one, a question around suggestions on accommodating people with addiction issues within safety-sensitive positions.
I don't know enough about addiction issues to comment on. Like, I don't know enough to really make decent, good kinds of recommendations around that. I know a little bit came out within the context of the electrical injury data where there were some concerns around it, and most of it was actually concerns around coworkers protecting other coworkers who might have come to work intoxicated. And the concern there, to some extent, was because they were because to a large extent the electrical workers are working in crews, and the safety of an individual worker also depends on the safety of the other worker. So that, I mean, for some larger employers within that industry, that is a big concern. But I would assume, I'm just going to make an assumption, but I don't know if it's correct or not. I would assume the same types of issues around disclosing would be concerns for anybody with addiction problems or anybody with mental health types of issues. So that might actually be interpreted, but I don't know enough about it to have a sense of, to be able to give specific recommendations. I'm sorry, it would be an interesting group to actually kind of look at. I mean, I know from the mental, there is lots written in mental health and around kind of stigma, and a lot of, strong kind of mental health advocates who I have spoken to will often, and I remember there was this woman who's since passed away, but she did a lot of she worked within the human resources department at CAMH here in Toronto, and her position was always, when she counseled individuals with mental health problems and finding work, she always counseled people to not say anything when they were initially looking for that particular job, because she thought the stigma was so great, people would never be given a chance. So it's just an interest. I mean, and different people have different perspectives, but like I said, I think making those decisions requires really an understanding of a number of different elements, and that the individual who's going to be disclosing being able to make an informed decision about the pros and cons of that disclosure, and then also how they're also would be managing any kind of communication within the context of their workplace on a day-to-day basis as well.
Right.
That's not an answer, because I'm sorry. Just those are the roundabout things that I kind of do know about that may inform, decisions from an addiction perspective.
Right, right. No, I think that's good. Okay, we are just a little bit over time, so I'm going to go ahead and end it. But thank you very much, Mary, for that presentation. It was very insightful and provided a lot of really great different perspectives from different groups around return to work and accommodation. It's very good.
Thank you for inviting me, and to everybody for listening.